Jacobs.
Of course. I have to hold this.
Is yours on a clip over there?
Yes.
Okay. Can you hear me all right? Well, my name is Warren Jacobs. I'm a medical doctor, and I'm very pleased to be here tonight. Actually, I'm more comfortable with a group of like-minded people like yourselves than I am with a group of medical doctors. So I want you to know that first of all. I had a traditional medical training. I'm not going to tell you how many years ago, but I've been in practice over 50 years in Escondido. And it wasn't very long in practice that I discovered, although I could make diagnosis fairly readily, the treatments that I offered somehow in chronic diseases were not very effective. If I saw a man with hypertension and he was obese and eating the kind of diet we just heard of from the previous speaker, I wasn't very effective in getting him to change his lifestyle so his health would improve. And when he would go on to either have a stroke or a heart attack, I felt about that big and very insignificant and very uncomfortable. And luckily, in 1974, I went to a medical meeting in San Diego by the Mandela Society, and there was this young chiropractor, John Thief from Pasadena, who got up and was pushing on people's arms and rubbing on their bodies. I didn't know what a meridian was at the time, and getting results. And a few weeks later, he's giving a class in this method he called Touch for Health. And they let this chiropractor into the medical school to give the test, to give the workshop. I couldn't believe it, because where I went to medical school, a chiropractor was looked on as a quack of some kind. Anyhow, I went down there with my nurse, and in a few minutes, I was doing the stuff, and it worked. Well, I studied Oriental medicine for about 8 years before I ever used it in my practice, but one day a patient came in with a frozen shoulder, and all the traditional things that worked didn't work, including a cortisone injection. And I got out a book, and I looked in the book and rubbed on the patient and looked something else up. I hardly knew what I was doing. And then I got finished. I said, let's see if you can raise your arm. She said, oh, I can't. The pain is terrible. I said, well, just try. And she went, like that. And I nearly fell down. And that was the beginning. Then I started using it for things that traditional medicine didn't work very well. But tonight we're talking about sexuality. So I'll tell you why I'm here over that. In the course, I got into this and began to teach this in many countries in the world, and in Europe mainly, and just for chronic illnesses. And oftentimes it would turn out that the basic problem, the basic reason the person had the gastrointestinal problem, or the headaches, or the shoulder pain, had a sexual basis. I couldn't believe it, but it would come out sexual. And they said over there, well, we test people with these methods. They have professional kinesiologists over there. And rarely does a sexual issue come up. And that's when I realized, if you're not open to something, or you have a block within yourself in a certain subject, it's just not going to come up in the patient. And I think many practitioners, especially medical doctors, well, somebody put it very well. They said, no doctor wants to diagnose something he's not comfortable in treating. And so even though it's right as clear as a hand in front of your face, you don't see it. Well, I was at a kinesiology convention some years ago in North Carolina, and two ladies gave a talk, Catherine Pritchett and Irene Yachuk. And I've got some of what they wrote here. They felt there were three main blocks to intimacy between a sexual couple. And they divided them into three categories. One were fear issues. An example of a fear issue: I am afraid of intimacy because it must involve sex and romance, or I'm afraid of commitment, or I'm afraid of closeness, or I'm afraid someone will know me. I'm afraid I will know myself. And who's familiar with applied kinesiology? Okay, we got a fair number of people. And you can muscle test for this. I was tested on these things. I couldn't believe some of the things I had inside that I didn't realize were there, because they're down in your subconscious. Do you follow that? Fear issues. The next group are teachings that are not helpful. They can be religious teachings or just traditions in the family. There's certain attitudes in the family that are against sexual intimacy. And we don't realize they're in there, but if you're brought up in that culture or in that religion that teaches that, even though many people say, oh, I haven't been to that kind of a church, I don't go there anymore. I left there when I was 8 years old. I said, they had you between the ages of 5 and 8, and you took catechism, or you were, believe me, it's in you. And you can't just dismiss it. And the third group are adverse experiences. And this is a way with kinesiology to uncover these things. Now, the correction that's done here is like nothing else I do. It's all done with symbols and colors. I don't know how it works, but I tell you it works. I've worked with many couples, and what you do is you identify the issues that are important in each category, and you quantify them, and then you have them choose one of the symbols. They're not here, but one is a yin-yang, one is a square, one is a triangle, one is a 5-pointed star, a 6-pointed star, one is a pentagon. What the significance is escapes me, but I tell you, it works. And the people report great improvements in their intimacy. Now, what do we mean by intimacy? Well, there's a man, Dan McAdams, and he wrote a book on intimacy. And let's see, I don't know that that came out here. No, I don't see it here. And he says that when there's intimacy between couples, there's a commitment. Not that you think, well, I should be committed because we have that kind of an agreement, we're married or we live together for 10 years. But you just feel that what's going on in that person is of some importance to you. There's also a sense of harmony. In other words, you're in the kitchen, you're preparing the salad for supper, and without speaking, you just sort of glide around one another. You just feel that person needs the knife you're working with, and you hand it. You don't need speech. It's just a kind of a harmony that goes without words. There's a kind of an exclusion, a privateness that's, maybe you've had a bad day and your partner's had a bad day, but when you come home, it's like another world. And it doesn't matter what happened during the day. That's out there, and this is here. So there's a kind of separation from the outside world. In the same way, there's a new connection to the outside world. When you have this intimacy and harmony between you, the flowers are more beautiful. The sunset isn't the thing, it's sharing the sunset. That's the experience. Okay? There's a sense of union. If you're close and you're touching, you really don't know if you're touching your own body or the other person. It's like you become one. Now, there's sexuality on all levels. It can be a one-night stand, it can be organ pleasure, but on the other end, it can be a long-term relationship with one person who's very special to you. And there's nothing wrong with this kind of sexuality or that kind. It all depends on what you want and what you're ready for. It may be very different when you're 20 than when you're 60 or when you're 80 like me. We change. Hopefully we change. Some never change. Okay? The point is, wherever you are, what you want different, you have to start communicating about it. And that's really what I do in my practice. Not that I just see sexual problems, but very often there's some problem on the surface, and when you get down to it a little bit, it really has to do with sex. Now, you got another minute? Sure. Okay. What I do, let's say, I can move over there. You consider, get that only goes so far. In relationship, I like to put this triangle up. And what I have in this corner passion, in this corner intimacy, and in this corner commitment. And I ask each person in the relationship, where do you stand in each of these areas? Do you have passion for your partner? Does your partner have passion for you? So I put a plus to each if that's true. Commitment. What does commitment mean? I'm here for the long run. I'm going to stay with you no matter what. Now that's not always there. But if it's there, you put a plus and a plus. What about intimacy? What does that mean? Intimacy means I'm willing to be known and I want to know you. Okay? And that's the most common one that doesn't hold. Okay? They'll say, well, I'm sort of this way and that way. And if that's true, there's something in their history that made them shy about really coming that close to another person. And in my experience, that's where the difficulty is. I don't find so often that it's plumbing, or it's diet, or it's money. There's the problem. That somebody is unsatisfied because they either are unwilling to know or be known by the other. Thank you.